Hello and welcome to the Reflection Show with me, Martha and Spice. Today we want to have an amazing conversation. We want to look at mental health, the different kinds of issues or conditions that we describe as mental health. Bipolar, depression, sadness, etc. They are all forms of mental health that we need to pay attention to. Unfortunately, sometimes we don't take some of these things seriously and we end up finding ourselves in a situation that hurts our emotions so bad. Let's go for a break. We'll be back. Welcome back. It's the Reflection Show with me, Martha and Spice. Like I said in my intro, we want to look at mental health, and I have here in my studio again Dr. Norbert Kipu. Thank you very much for joining me.
Thank you very much for having me.
The last time we spoke about sickle cell, now we want to look at mental health in general, and it has been a very critical issue affecting a lot of. In fact, today I want us to look at the youth, young people. We don't take some of these things seriously, and apart from the spiritual implications that we might know people roaming on the streets, but let's look at how we, those still quote unquote normal in our houses, can be affected by mental health. So what is mental health in general?
Thank you very much for having me once again, and a beautiful day to all your viewers all across the region and the country at large. Mental health is a very important aspect of health. In fact, a very important aspect of our general living. When the WHO defines health, they make room for mental health. So without mental health, your health is not complete. You can be well physically, but if your psychological well-being is compromised, then we don't think you are healthy. So mental health encompasses the general psychological well-being of an individual. It includes the person's social function, cognitive function, the person's emotions. When we talk about cognitive function, we simply mean the conscious mental activity. So our ability to read, our ability to write, calculate, imagine, remember, think logically, all that is what we talk about. That's what we mean by when we talk about cognitive ability. It also involves our ability to manage the stresses, daily stresses, and the challenges of life. So mental health in itself is a good thing because generally, it helps the person enjoy life, to have a satisfying life. So mental health illness is when any of these is compromised, like I've just explained. So a simple way by definition is anything or any condition that affects the way we think, the way we feel, and the way we behave. So much that is distressing to the individual and affects his social and occupational function. So when we talk about mental health, the symptoms, they are just behaviors, they are just emotions, which everyone goes through emotions at certain points in time. We behave certain way at certain points in time. It does not qualify it to be a mental health illness. It only becomes a mental health illness if one is persistent. It stays for some time. It deviates from the normal. And by normal, that's quite technical a definition. I don't want to go into the details, but we have certain things we think are normal. So when there's a deviation from that normal, and it persists for some time, and it affects the individual's social relations. When we talk about social relations, the way the person relates with family, friends, neighbors, colleagues at work and all. And also if it affects the person's occupational function, that's the person's ability to work. If the person is a student, his ability to study, his productivity, then we can call it a mental health illness.
So how does this come about? How does it start?
Okay, so for mental health illnesses, or the field of psychiatry and psychology, we classify most of our things on three pillars. One is biological, one is psychological, and the other is social. So for short, biopsychosocial. When we talk of biological, we are talking about the structure and the function of the human body. So if there's anything unusual with the structure or the function of the human body, then it can manifest as a mental illness, particularly with the brain and the nerves and other central nervous system organs. So one, if the patient or the person has, say, a growth, an abnormal growth or a tumor in certain parts of the brain, it can manifest as a mental illness. the brain communicates with the other parts of the body through chemicals, through electricity. Let me put it there, electrical impulses. So when there's an imbalance between these chemicals or these electrical activities, it can manifest as a mental illness. Going into detail, so for example, for the chemicals, we put them under two main groups. We have what we call the excitatory chemicals, neurotransmitters, and the inhibitory ones. So like the name suggests, excitatory, they are those that cause us to do, they are those that increase our mood, make us happy. It's one that brings activity. Then the other chemicals, the inhibitory ones, are those that calm us down, inhibit our activity, make us relax, and all those things. So when there's an imbalance in these chemicals, then there's a problem. So for instance, if the inhibitory ones that relax us, calm us down, brings about inactivity is too much, then the patient will be tipping into depression because they don't have any interest in, because the chemicals that causes inactivity is too much. So they are just in a state of inactivity. They don't want to do anything. Their mood is down. They are not happy, and so forth. If you also have the other way around, the excitatory ones are too high, then they are overly energetic, they talk a lot, they want to do, they want to move, they cannot sleep, and things like that. So when those chemicals are, are mixed up, they are not in their right proportions or right balance, then it can manifest as a mental illness. Likewise, the electrical impulses also. And a common disease or a common condition is what we call epilepsy or seizure disorders. It's just an abnormal electrical impulse. So
cerebral palsy, or how do you call
yes, so cerebral palsy, even though it has to do with the brain, is not classified as a mental health illness because mostly it affects the motor function. Motor function is our movements and things like that. So they are not able to control their movements. Either they are too spastic or they are too relaxed and things like that. So it's not classified mostly under mental health. It's more of pediatric and things like that. So usually when we are dealing with mental health, we don't include cerebral palsy that much. Yes, so with seizure disorders or epilepsy, there's an abnormal firing of electrical impulses. So the brain starts to fire abnormally. There is nothing to stop that firing, and then the body starts to either violently contract because the brain is telling it to contract and things like that. So when there's also an imbalance in those chemicals, then you can have a challenge. Substance use also affects the way the brain works. So biologically, the brain is affected. So those are some of the few things that come under the biological component.
Like the hard drugs,
Yes. So substances are chemicals. That's just, medications are chemicals, or drugs are chemicals that just affect the way the body works. But when we talk about mental health, we are talking of those that affect the brain. So we call them psychoactive substances. So like alcohol, like tobacco, like caffeine, like marijuana, which is cannabis, like cocaine, heroin, and things like that, tramadol and other opioids. They affect the way the brain works. So those ones can also predispose an individual to having a mental health illness. So that's for the biological component. For the psychological aspect, psychology simply just means how we think, how we perceive life issues, how we are raised up to view the world. So there are two people, both of them fail an exam. The other person is sad. He goes to lock himself in a room. He cries for 2 weeks. He doesn't talk to anybody because he has failed an exam. Another person fails that same exam, and he laughs about it with his friends. He sees it as an opportunity to better himself and all. So the way we view life's challenges and things like that can predispose us to mental health illnesses. So that's basically it for the psychology. It's just how we view issues.
That was my next question on some of the risk factors. You've mentioned the hard drugs and all of that. But what can normal sadness, something happens, and just like you used the example of someone failing their exams, at what point does it grows to become depression?
Okay, so it's normal to be sad. Like I said at the beginning, when we start talking about the symptoms of mental health, I'm sure many of our viewers will start diagnosing themselves at home. Because at certain points in time, we have all experienced certain emotions, we have all done certain things. There are sometimes you think you heard someone call you. It's not like you are hearing voices. These things happen once in a while.
Yeah, sometimes you hear, I live alone, but sometimes you hear someone mention your name, you come out, or someone knocking at your door, you come out and
exactly,
and no one is...
Exactly. So when we talk about the symptoms, at certain points in time, almost everyone goes through those emotions. It becomes a problem when it's persistent.
Okay.
When that sadness stays for more than 2 weeks. When that sadness starts affecting the individual, when that sadness starts affecting the person's social relations, when that sadness affects his studies or his ability to work or his productivity, then it becomes a mental illness. But if you fail an exam and you are sad for 2-3 days, that's expected. That is a normal reaction to that stressor. If you lose a loved one and you are sad for 2 weeks, 3 weeks, that is normal. That is expected. That's an expected reaction to that stressor. But when that reaction now becomes persistent, you say you lose a loved one and 12 months in the year, you are still sad, you don't want to come out, you don't want to talk to anyone, then we are concerned, we are worried, because then we don't deem it as a normal reaction to that stressor. So that's what I'm saying. When it comes to what's normal and what's not normal, that's quite technical, and I will not want to go into that detail. But then, simply put, when those conditions start to distress the individual and affect social function, occupational function, then we are concerned that this could be a mental health illness. The last component was on the social aspects. So there are many social events that can tip individuals into mental health illnesses. For example, like I mentioned, losing a loved one, failing an exam, unemployment, relationship issues, bad news, stuff like that can all. So those are social.
One of the things that sometimes makes me have, let me say, mental health illness, like when you lose money, like in that one day, I saw a tweet that said that you want to be an entrepreneur, but you lose your 40 cedis, you cry for like a whole day. Imagine being an entrepreneur that you have to lose a lot of money all the time.
Yeah.
But I think that losing a lot of money is one of the things that makes people really want to be very sad.
It's a social event. So there was this time I was seeing a patient last year who we were managing for depression, and what actually triggered his depression was that he invested a huge amount of money and that investment didn't work. So because it didn't work, I think he was having family issues. He couldn't fend for his family again. He had issues with his wife, and that tipped him into depression. So this is a classical example of a social event that actually pushed the person. If he hadn't lost that money, I don't think we would have been seeing him in the facility to manage him for any mental health illness. So social events around us can predispose an individual or can cause a mental health illness. So basically these are the three main things that can bring about mental illness. So I just want to chip this in at this point. So this is why for lack of a better expression, it doesn't make sense to actually stigmatize people that have mental health illnesses. It could just be genetic. In fact, that is the biggest risk factor. We are here to talk about the risk factors, but the biggest risk factor to mental health is genetics. It's genetics. So people, I don't want to say they are born with it, but they are born with the predisposition to have a mental illness. So then why would you want to stigmatize against someone who, through no fault of his, some people develop their mental later in life. So you see they are working, they are sharply dressed, and all of a sudden things start going bad in their life. They start hearing voices, they start, through no fault of theirs. It's not like they've done anything. But then some people, most of the time out of ignorance, tend to stigmatize those persons with mental health. So the last thing you want to do for someone who has mental health, if you cannot help the person, if you cannot say anything positive, you might probably just keep quiet and mind your business. But then to stigmatize against them is
what other risk factors? I'm just shocked about the genetics. Imagine out of no fault of yours, because your family is in that lineage, apart from that, what other risk factors do we have? I think you've mentioned the drugs, the hard drugs as well, and even the kind of normal drugs that we take sometimes can have an effect. So
aside the genetics, family predisposition, substance use, unemployment is a risk factor.
Serious one.
Yes, so people who are unemployed tend to develop mental health illnesses because I think it's quite obvious.
Very obvious.
Financially, they are not able to meet their needs. They can't meet their basic needs, food, shelter, clothing. Financial insecurity is there. They are not secure, and things like that. So unemployment is one. People who live in societies where there is social injustice. So places like this, racism, people feel like places like South Africa where there's apartheid and things like that. So places where there's social injustice. It must not necessarily be
safe.
Yes.
Wherever they are.
It might not necessarily be something so big. It could just be the subtle things in society where probably some groups of people feel they are cheated, they are not being respected, they are not things like that can also predispose individuals to mental health illnesses. I also spoke about the psychology, the way we are all raised, our beliefs of life can also put people into having mental health illnesses. So these are but a few of the risk factors. But generally, when it comes to mental health, most of the time, we don't know the cause. Most of the time, you can have an individual who doesn't fall under any of these risk factors.
Yeah.
In the family lineage, there's no one who has similar symptoms
person
as
doesn't
him.
drink or
He doesn't
smoke,
take any
probably.
substances.
The person
nothing.
is employed,
Yes,
probably
he's
married,
employed,
has a lot,
working,
yeah.
doing very well at his workplace, then all of a sudden starts hearing voices, starts seeing images, starts behaving unusually. So most of the time, we don't know the cause. And that's why mental health is an interesting field. It gives room for more research, room for us to learn and discover more. There's still a lot to do in that area. Yes, but most of the time, for people with mental health illnesses, we can't point exactly to what the problem is.
I want us to look at the different types of mental health. There are times that you hear different kinds of names and they say, well, this is also a mental health condition. It's a mental health illness. But sometimes it's confusing. At the end of the day, it's not just the idea of not being well mentally. What are the differences? So one thing that we keep, let me start from, let me say that. So let's look at sadness, depression, and bipolar. Let's look at these three ones, or sadness and depression, before we come to bipolar.
Okay, all right. Thank you very much. First off, I just want to explain that sadness is not a mental health illness.
Okay.
It's just a normal emotion we all experience.
Okay.
It's like putting happiness as a mental health illness. So sadness is fine to be sad. It's okay to be sad. But like I said, then when it becomes persistent and starts to affect social and occupational function, then we can find a better disease condition and put it under. Sadness is mostly directly linked to depression. Depression is the mental health illness.
Okay.
Sadness is not. Like I said, instances or social events can make an individual sad, and that's totally fine. That's totally normal to be sad. But then when it persists, it becomes a challenge then. So with depression, there is sadness that persists for more than 2 weeks. That persists for more than 2 weeks. Individuals with depression will present with what we call anhedonia, loss of interest. They just become, everything becomes so not interesting to them. I don't know how I can explain it. So someone who previously liked watching movies is not interested in watching movies. Someone who previously wanted to hang out with friends now doesn't go out. They are just locked in the room. They've lost interest in anything. If they used to read, they don't read again. If he used to work, he just wakes up. He doesn't feel like going to work. They lose interest in activities they previously liked. Sometimes they could have pathological or unusual feelings of guilt. So they start to blame themselves for things
everything
that may not even be their fault. Sometimes, of course, they can be instances that you can trace it to, but you see that they exaggerate it.
Their reaction,
They exaggerate it. They start to blame themselves for things that sometimes does not even affect them, does not even concern them. They may have feelings of helplessness, feelings of hopelessness. They feel like, this is my situation, nothing can change. So they just give up. They can have feelings of hopelessness. Sometimes they have feelings of worthlessness. They think they are not important. They think no one respects them. They think no one sees any value in them. Sometimes they can have that perception of themselves.
True.
They could also have sleep disturbances. They don't sleep much. Either they find it difficult sleeping, or they're able to fall asleep, but they wake up several times in the night and find it difficult to sleep again, and things like that. It could affect their eating. So most of them just lose appetite. In few instances, they tend to eat more as a compensatory effect, but most of the time, they have very low appetite. They lose weight, yes. It can affect their concentration also. So a simple mathematics question that they could have actually solved, it's a simple calculation, 100 minus 7, that on a normal day, they would have just said it so easily. They tend to lose concentration. If you give them a task that they are supposed to do continuous, they can start it, but they can't sustain that concentration. You are talking to them, they are following, and at a point, they don't even know, they are lost in their thoughts. They don't know what's going on, so it can affect their concentration as well. They become dull. Sometimes they are socially withdrawn. They don't want to see anybody. They don't want anyone to talk to them. Sometimes they break down in tears, what we call crying spells. There's also something we call blank staring. They are just sitting down, focused on something, They're just looking at the wall. You don't know what they are thinking about.
Yeah.
They are not talking. They are not moving. They can stay in that position for about 20 minutes, just
Yeah.
like that. So it's a state of, should I say, severe sadness, if that will pass.
Yeah.
It's a state of severe sadness that manifests in other forms. It's not just about the sadness. Now it's affecting their eating. It's affecting their sleeping. They are beginning to have thoughts about themselves that are not real, like worthlessness, hopelessness, blaming themselves for other things, and that's the whole thing we classify as depression. With depression, it could be organic or inorganic. When we talk about organic or inorganic are the ones you can actually point something to. Oh, he failed his exam and he became sad.
Okay.
So I think it's the exam that's causing it. Or he was in a relationship and it didn't go well and he's sad. You can point to something.
Something to it.
He lost his job. He's not able to take care of his family. You can point something to it. But the other one, they are doing just fine. There is no stressor in their life. Nobody has passed. They have not failed any exam. They are well employed. And all of a sudden, they lose interest. They don't want to talk to anyone. They are socially withdrawn. They are not eating well. They are not sleeping well. They are losing weight. Things like that. Then you cannot point anything socially to what's causing that severe sadness. Then we say that could be organic. It could be something that's just going on in the brain. The chemicals that causes inactivity are being produced excessively. Things like that. So those ones, you really cannot point anything
Out, okay.
to it. Yes.
Okay. Now, let's look at bipolar.
Bipolar, that's a big one. That's a big one.
Yeah, because there are times that you hear in the news, of course, we've had very influential people and even celebrities that you hear that they have bipolar disorders and all of that. But before we take that, I want us to go for a break. Stay tuned.
My name is Sule Barika. I'm from Yawoko community. We came here for the Lead Decide program in collaboration with the Plan Ghana. As we came here, we learned a lot. We learned about self-determination.
My name is Mahama Dorita. I come from Guabelga. I came here for the Lead Decide program. And when I came here, I learned a lot of things. Things like I learned how to determine myself, know my weakness and strength. And I really appreciate and say thank you to Matter Inspire Foundation.
My name is Faisal Faiza. I'm from Gbanu community. We came here to learn about self-determination and self-weakness.
And due to that, we learn about our strengths and weakness points, what we know, what we like and what we dislike in order to help other people. So thank you, Matter Inspires Foundation.
Welcome back. We're still here talking about mental health and how you and I can make sure that we are staying healthy, strongly, mentally. Before we went on the break, we wanted to look at bipolar. It's a big one. You said it was a big one. Because there are times that you hear big names of people who have had bipolar disorder. Sometimes they don't even know. They have never known. Their relatives don't even know. And what is bipolar?
Thank you very much. So bipolar affective disorder, that's the, should I say the technical name? Affective or affect simply means mood. So the definition is in the name. Bipolar, two poles, that's the two extreme ends of mood. So for the extreme ends of mood, we are either too excited, too happy, or we are too sad, too depressed. Most of the time, we are all in the middle. Based on our social events, we drift one side or the other. So if you hear some good news, you are more excited, you drift there, but you're back. Basically, you are in the middle and you just drift a bit to either side based on what's happening in your life.
So you are by
Bipolar,
happy or by sad?
Yes, bipolar means they have the two poles.
Okay.
And they move to the extreme ends. So you are just excited a bit, you are happy, you jump small, you are fine that you've had good news, you hang out with your friends, you come back, that's about it. Their excitement is to the extreme end. So they have too much energy. That's the extreme end of, should I say, happiness, what we call mania. So mania is characterized by too much excitement. So it's not the excitement we know, but like excitement as in too much energy. So they don't have a need to sleep. It's not like they want to sleep, but the sleep is not coming. They don't feel like sleeping at all. They are too energized. So they stay up. They are walking up and down in the room. They are watching a movie. They are pressing their phone. They are pressing their computer. And they can stay till like 4 a.m. They sleep like 1 hour, 2 hours. They wake up. They don't feel tired. It's not like he has woken up and he's tired. He wakes up fine. He doesn't think it's a problem. They are too excited. They talk a lot. And usually for those people, that's one characteristic you can use to know. They talk a lot. So they start talking. You can't stop them. That's what we call pressured speech. You can't interrupt them. If you interrupt them, they still have to continue what they are talking about. And they switch topics very fast. We call that flight of ideas. They have too many ideas. So, for instance, there was this patient of ours who, when you even reach his bed and you want to even discuss the case with other members of the team, he starts talking. Doctor, which school did you complete? Oh, I attended, what school did you mention? Okay, let me not mention. I attended the school. Oh, it's a very good school. I passed my exam. When we were writing, oh, they all wanted to copy from me. Now I work in a lab. He was talking about school. All of a sudden, he says he works in a lab. Then he's talking about the lab. Then he asked about another private hospital. Then he started talking about a bank. Then he went straight to football. They have flight of ideas. They switch topics just like that. They have too much energy. Too many ideas are coming. So they keep switching topics, and it's difficult to interrupt them, those people. So that's one of the characteristics. There's another thing we call grandiosity. They think highly of themselves. Most of the time, not true. So it could be of identity. He feels he's either a rich person, he feels he's a big person, he knows the president, he boils with the ministers, they are his friends, there are people he chills with. He tells you he has 2-3 cars in the house. Most of the time, it's not true. That's what we call a delusion. They think highly of themselves.
You want to feel better about the things that
Okay, well, you can put it that way. But
or the things they wish, rather.
Yes, kind of. Aside the identity, also, they have this delusion of ability. So they can tell you that they are prophets. They can see your future. While they are sitting here, they can hear what those sitting outside are talking about. They think they possess certain abilities. Some say, oh, they talk to God directly. They hear angels talk. They've been boiling with angels and things like that. So yes, those are some of the things. Like sometimes too, they can have this delusion of, let me say, they have this delusion that someone big in society loves them. So he says, oh, this person is my boyfriend, or this person is I'm married to Otumfuo's brother, things like that. So they have this. Yes, they have this level of grandiosity, which most of the time is not true. They could have impulsive behaviors, as in they just suddenly do something that on a normal day they won't do, because of course their brain will tell them not to do. So they can strip naked because there's no inhibition to that. They can do risky things. They can cross the road without even looking left, right, center. They can buy things they don't need. For example, you would have thought so much before you probably want to buy maybe a car. You would have thought so much, put your things in order. But once they have the money, they can just get up and walk. That's another symptom with which we are able to find out. Sometimes the relatives realize that they are buying things they don't need. They realize that this guy is now buying too many shoes. Black shoe, he has bought 3, 4, 5 black shoes. Then recently he was going to add 3 black shoes. So they start to suspect that things are not right. They buy things they don't need. They go and they find.
All of us need to really be, because there are times as we know people and like, this girl or this guy, he likes shopping or he likes probably buying groceries. So I think that these are some things that we also need to do to help our friends, our relatives, and not think that that's just a character.
I get what you are saying. So that's the interesting thing about mental health. Sometimes, or most of the time, people with mental health illnesses do not know they are sick.
Of course, yeah.
Unlike the regular illnesses, if you have headache, you know you have a headache. But for them, sometimes what they are doing, they think it's normal. So it takes their relatives, it takes their friends to be able to fish out. And most of the time, even in the hospital, when they come, you would notice that it's the relatives who bring them. oh, we noticed that of late he has been doing this, and we think that is not usual of him. That is why we are bringing him here. Sometimes it could be usual of someone else. For example, if the world's richest man is spending 200,000 Ghana cedis a day, that could be normal.
Yeah, that's usual.
But if, no disrespect to anybody, but if, let's say, someone in Tamale whose job pays less than 5,000 cedis starts to spend even 2,000 cedis a day, we have to look
unless
at it.
It's something he has probably planned to say, okay, today I want to buy some electronics, and just gets up and goes into the market. I want to buy this wig, I want to buy this clothes.
Yes, but if he's doing it two days in a row, 3 days in a row, and we know that that's not something he does. So in mental health, we assess the symptom in relation to what is usual of that person. So it could be usual for someone else, but to that person it's not usual. Then it raises red flags. We have to be concerned about the person. So back to the issue of bipolar. So you see that we are talking about one extreme pole. Now the thing about those people is that they experience both poles. So aside that, there are also times that they are the other end, where they are sad. They are just depressed, basically. They are sad. They don't want to talk to anybody. They are not sleeping well. They are not eating well. They've lost concentration. They have lost interest in what they are doing. They don't want to go to work again. They are just dull and sad and slow in movement and everything. So bipolar means they experience both poles at certain times. If they are experiencing just one pole, let's say just the sadness, then that's depression.
Can it be aggressive?
Oh, yes. So I didn't add this. Thank you very much for bringing it up. That's a good call. On the part of mania, that's when they are excited. Too much energy, they can become verbally aggressive. They start talking trash to anybody they meet. They could also be physically aggressive. It's not so common. It's not so common. But then when people want to intervene, when people want to prevent them from doing, for example, they are spending so much, and maybe their spouse believes that this is not usual and wants to prevent him from spending, then they become verbally aggressive. They can become physically aggressive. If they are prevented from doing the things they want to do, then it becomes a challenge. But usually on a normal day, if they have the free chance to do what they want to do, it won't be characterized by aggression.
Before you get married, you have to ask your spouse if they have any mental health history.
Well,
is it something you can just go to the hospital and check, like sickle cell? You can just check your genotype?
Unfortunately, no. Unfortunately, no.
So you have to probably know the person for some time before you can have...
It's not a guarantee. It's not a guarantee.
My goodness.
The fact that someone's father has a mental health illness does not mean the person have a mental health illness. And like I said, most of the time you trace and there's nothing there. So people who have mental health illnesses, most of the time when you check the family, there's no history.
Does it start, so people who have mental illness, is it like it starts from childhood, or even as an adult, at any point in time it can start?
So there are different types of mental health illnesses. It's not one. Like you've mentioned, there's depression, there's bipolar.
No, but I mean in bipolar.
So in bipolar, it usually manifests in early adulthood.
Okay.
That is when they mostly get their first, should I say, crisis or episode. So in early adulthood, in their teens, in their 20s, sometimes some may present somewhere in their 30s, but most of the time, characteristically, it presents in late teens and the early 20s. That's when they have their first experience or their first episode.
Okay.
Yes.
Okay. Now let's look at substance use
disorders. Okay. So substance use disorders, that's another big one. Another big one. It's big because the substances are many and they are different. So every substance has its own presentation, its own manifestation. But some few things cut across all of them. So one is that those substances can affect the psychology or the psychological well-being of the individual, the way they think, the way they act, the way they behave, the way they feel. It affects the mind and things like that. So we have some drugs that are depressants. They calm you down, they make you relax, they put you in a state of inactivity and things like that. Like the opioids, the tramadols and those things, the heroines, morphines, that's what they do. Then we have those that are stimulants, the cocaines and the others, methamphetamines and codeine, make you active and hyper and so excited, too much energy and things like that.
Is weed the same as marijuana?
Yes, so marijuana, different, they have different names. People call it weed, some call it, but the official name is cannabis. That's the official name, cannabis. In the books and all, you see cannabis. But it's the same thing, different people have different names for it. And in fact, that's the thing about substances. They have so many code names because of, I don't want to say the stigma. The society doesn't really accept them, especially where we are. So people try to give code names. So depending on the locality, you have.
What are the effects of marijuana? That's the commonest one lots of young people take.
So when they take marijuana, it's a
Does it cause a
hallucinogen.
relief?
So most of them who take it say it makes them feel relaxed. That's what it says. It says it makes them feel calm and relaxed. But then another thing marijuana does, well documented, well researched, is that it causes hallucinations. Hallucinations simply means perceptions that are not real. They are hearing things that are not there. They are hearing sounds that are not there. They are seeing things that aren't there. They are feeling things that are actually not there. No one is touching them. Nothing is walking on them, but they are feeling. So they begin to have a distorted idea of perception. Most of the time they hear things that no one's talking, no one is saying anything, but they are hearing voices. But most of them say it makes them feel calm. So the thing about substance use is that, again, there's a genetic predisposition.
Okay.
So you have two people. One person is taking marijuana, 2 rolls or whatever quantity. Another person is taking the same. One takes it for 10 years and is still fine, let me see, goes about his business, goes about his work and everything. Another takes it for 2 weeks and then it becomes a full-blown mental illness. So there's also a genetic predisposition to that. But then that's the risk. Like I mentioned, substance use is one of the risk factors for mental illnesses. So once someone continues to take substances, it predisposes them to getting the other mental health conditions. But aside that, the substance itself, the use of it can be a mental illness. So we call it substance use disorder. So those comes about when individuals have to increase the dose to get the same feeling. So most of the time, he starts with 1 stick of cigarettes, 1 stick. Then after 2 weeks, the feeling that 1 stick was giving him, after 2 weeks, it's not giving him that same feeling. He has to increase it to 2 sticks to be able to get the same feeling that 1 stick could give him. At a certain point, he has to increase it to maybe 4 sticks to get that same feeling. So that's what we call tolerance. The body is becoming used to.
Yeah.
So you have to continue to increase and continue to increase just to be able to satisfy that feeling. Now we have what we call dependence. It gets to a point that the body is now dependent on that substance. Once that substance is not there, the body begins to act up. Just like a child who you give a toffee every day. The day you don't give him the toffee, he begins to throw tantrums and rolling all over the floor. That's how the body is. So you are feeding the body with marijuana every day, feeding it with the day you don't give it, the body receptors feel like there's something missing. We are expecting something and it's not coming. Then it begins to act up. Then that's what we call withdrawal symptoms. They have symptoms because they have stopped. And that's why it becomes very difficult for them to stop. Because once they don't get it, the body starts messing up. It starts acting up, vomiting. Like I said, it's dependent on the substance. So they could vomit, diarrhea, abdominal pain, tremors. They are just sitting and their body shaking involuntarily. They could even have seizures. They could have the hallucinations I'm talking about, severe headaches. It comes in different forms based on the substance the individual is taking. So because of that very that huge discomfort, severe discomfort they are experiencing, they just feel like, let me just go back to the substance. And because of that, it's also difficult for them to stop. So they will do whatever it takes to be able to get the substance. Some begin to tell lies to their relatives, oh, I need this for books, just because they have to get the substance. Else, the distress they are going through is severe. So at that point, we say the person has a substance use disorder. Even though he doesn't have depression, he doesn't have the bipolar, he doesn't have the schizophrenia, but the substance the person is using in itself has now become a disorder for the person.
How about anxiety disorders?
Anxiety disorders. Interestingly, anxiety disorders is the most diagnosed mental health illness across the world. In fact, they say it's the most common.
Okay, so what is it? How do I know I have anxiety disorders?
So anxiety disorders is simply put worrying, unusual worrying. They are worried about, sometimes it could be general, so they just have this worry about.
Like fear of the unknown.
Thank you, let me put it that way. They have fear of, for some people it's known, for some people the anxiety is specific. So it's specific, maybe he's afraid of being alone. He's afraid of being in a bus because he feels like...
Or you've written an exam and you're just worried how the outcome
So for some
is.
people, the anxiety is specific. There are some, it's just general. They are just worried. They cannot tell you what exactly they are worried about. They are just troubled. And it's so bad that they now start having palpitations. Their heart is beating so fast. They could have panic attacks, sudden intense fear that could last about 2 or 3 minutes. Some have difficulty breathing. They have severe chest pain. At that moment, some say they feel like they are going to die. All those are panic attacks. So for
And
general,
most times it happens in the night, like when your brother or something. And I've been there before, where you are worrying about a lot of things, and you are even afraid to sleep. You don't know if you sleep, whether you're going to wake up in the morning, you're going to die. And well, let's go for a break. When we come back, look at that one. I don't want to mention the name. We'll be back.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Marcus King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of Kingdom Dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle, and many more.
Welcome back. Still trying to understand everything, mental health, and how you and I can stay healthy, because I don't want to get to the point whereby I'll have any of these mental health issues. No. I want to enjoy my life. I want to chill. So we all need to research. We all need to learn. We all need to be able to understand that in as much as our body is something that we want to pay attention to go to the hospital, we also need to take our mental health issue very seriously. As for the doctors, and they are there to take our monies. So if you don't listen to them and you go, they will charge you very well. Even the government hospitals, they are still charging. Imagine the private hospitals. So please, let's make sure that we are staying very healthy. The other mental health condition, please, you know what? My tongue not tell. Mention it and tell us what it's about.
Okay, so yes, but by the way, when you come to the hospital, we'll still charge you. Health is important, and health is expensive, so you have to prepare yourself.
You people, I don't understand. If people go to the church and the pastor say pay this amount and we'll pray for them, we'll be blaming the pastors. But you people, when we can, you charge us.
But you know,
I'm not serving humanity.
Health is the only place that when people are charged, they complain. No. When you send your car to the mechanic, you pay.
No, we also complain there.
When you go to the lawyer, you pay.
No, you and the lawyers that we complain.
When you go to the mechanic, you pay. The dressmaker, you pay.
You charge us too much.
Everyone you pay, but when it comes to the hospital,
doctors charge too much.
Now, health is very cheap.
It's not cheap.
Very cheap at TTH. Everything is free there.
It's okay.
But let's stick to the topic. Let's stick to the topic. So for schizophrenia.
Say it again. Take your time.
Schizophrenia.
Okay.
Yes. In Ghana is the bread and butter of mental health. Let me put it that way, because it's the condition which many people recognize.
Okay.
It's the one for which many people would attempt to seek medical care for. Okay. Most of the time, the other ones, the anxiety disorders, and people brush it aside, and they are able to
go to prayer
camps and do their own things. But most of the time, schizophrenia is the one that you would have people wanting a solution in the hospital for. So schizophrenia, it's common. Actually, you've seen a lot of people with schizophrenia, just that you didn't know that was the official name. So schizophrenia consists about 5, should I say components? 5. One is hallucinations. Hallucination was what I was explaining, false perception. They're either seeing something that's not there, hearing something that no one is saying, feeling someone touching them that's not there, smelling something that's not there. So they have a distorted sense of perception. That is hallucinations. The second one is delusions. So delusions is a false belief which is not consistent with their social and economic background. Even though there's evidence to the contrary, they still believe it. So for instance, someone says, I think you want to kill me. I don't have any evidence to that. I just think you want to kill me. Even when they have proven to me beyond reasonable doubt that you don't want to kill me, my mind still tells me you want to kill me. So you hear people saying, my mother is after me, or my brother wants, or my neighbor. So they go and fight with their neighbor because they think that because the neighbor came out of the door with a red shirt, today it means that
They want to share blood.
good. So they just have a belief that it's false, and despite evidence to the contrary, they still hold on to it. So there are people, someone is walking in the market, he sees two people talking, he says they are talking about me. Then it becomes an issue. Or he's watching TV and they are discussing something, he says it's about him they are talking about. Things like that. So they could have a delusion, a false belief that despite evidence to the contrary, they still stick to it and hold to it. So I've mentioned hallucinations, I've mentioned delusions, then they have what we call disorganized speech. So disorganized speech is it comes in different forms. So for instance, I ask you, what did you eat yesterday? Then the person starts saying that I attended St. James Seminary and from there I went to UDS. That is tangentiality. He has gone off the topic. He is not even addressing what you are saying. There are some who start addressing it and they drift. They start talking about the food. What did you eat? Oh, yesterday my mother prepared TZ, but the TZ, before I ate the TZ, I went to play football. Then at the football park, they gave us red card and we started fighting. He started talking about the food, but then he switched. There are others who go round and round and round, but will finally answer you. So we have different forms of disorganized speech. There are some who just create new words. They are saying things that you don't even know what they are talking about. So there's another component to schizophrenia.
Is this a bit linked to loss of memory?
No. That's quite different. That's quite
different.
Yeah, loss of memory. They are talking just okay. So
when people wake up, I've never seen some face to face except in movies. People wake up and they say they've lost their memory and they are speaking English. Do they remember their language?
Oh, memory is different from the language. They can just lose memory of things, events that have happened in the past. Yes. So that's another symptom. It's amnesia. It could be. So usually mostly there's a psychological event. Something has happened and they've lost their memory. Yes, that's quite different. So things are happening. They speak English. They speak their language and all. Their cognitive function is they can still talk, they can read, they can write, they can calculate, they can imagine. But things that have happened in the past is wiped. So they don't remember that he works here. He doesn't remember that he stays here. He doesn't remember that this is his sister or his mother. But from then moving on, they could have their memory back. So memory is different from the disorganized speech. The disorganized speech, the speech is disorganized. So he might be speaking English, but he's not addressing your... Those who have lost their memory, when you ask them questions, they address it. If they know, they give you the answer. If they don't know, they tell you that I don't remember. So they have lost their memory, but it's not that...
They can communicate.
Yes, they can communicate. So aside disorganized speech, there's also another one, disorganized... Aside the disorganized speech, there's also disorganized thought. Yes, so... Just it's almost around the same thing. Yes, it's almost around the same thing. Then there's what we call unusual behavior. This is very controversial because now who determines what is usual and what is not usual? But most of the time, it boils down to the people around. If someone starts behaving in a way that is not usual of them, then it raises a concern. You have to be concerned. So the unusual behavior could come in different forms. The person gets up, he doesn't pray, he's not so prayerful, but all of a sudden, he's running around the house and he says he's praying. This is not usual of the person. But there are other people who pray in the night. It's usual of them. But for someone who doesn't do that and all of a sudden he's doing that, then it becomes unusual of the person. You see, it comes in different forms. Like, in its sense, unusual is unusual. You have someone, he just sits he kneels in the middle, he raises his hand. He kneels in the middle of his room and he has raised his hand. And the people don't understand what is going on. He lies on the floor and he starts rolling. He takes off his shirt and he's walking on the roadside. This is not something that he would do. But now he's now exhibiting unusual behavior. The unusual behavior could come in many forms. Some just gather rubbish and they keep them. Some remove all the things from their room and put it outside. You ask them what they are doing. Yes, just unusual
Man,
stuff.
I don't use, of course, he's mentally challenged. I was standing somewhere, and just people were running away from him, and I was scared when he was getting. He just got to me, remove 5 6 engaged in Arabic. I was calling him, he wasn't minding me, and people were like, he's mentally challenged.
So you find out mostly in bipolar. Bipolar, there's over generosity. They
You
start
should have given me 10,000.
they start dashing things they have in their room. They start giving out money. It's part of the reckless behavior. On a normal day, they probably wouldn't have done that, but now they are quite reckless. They give out things that they probably need. They just overly generous. So back to the schizophrenia. The last one is what we call negative symptoms. So they have a straight face. They don't exhibit emotion. They are not laughing. They are not frowning. They are not smiling. They don't react to things around them. They speak less, like they don't talk much. They have apathy. They are not interested in things. They are slow. So those negative symptoms. Yes. So after having described this, I'm sure you've seen a lot of such people. The people, excuse my language, this is not something we use in mental health, but the people most call, in quotes, mad, that are walking on the street, most of them tend to have schizophrenia. Yes. So the symptoms there are many symptoms. Because I said unusual behavior, so it could be anything unusual of them. They neglect their personal hygiene. They hoard, that's they pick things that they don't need. They keep things that they don't need. Some just gather rubbish and things like that. They don't want to live in a house. They wander the streets. They are just walking. They have a house, but he prefers to sit outside. He prefers to sit under a tree. He's there. He doesn't want to change his clothes. He doesn't want to take his bath and things like that. So it could present in different forms, and that's should I say what we call schizophrenia.
Time, and I want you to box certain things for me. What do you do when you, as a person, realize that you have certain symptoms,
Okay.
or you realize that a relative has certain symptoms
Okay.
of this?
Okay.
Can some of them be spiritual? And how can we do to safeguard some of these things? And then, like everything, how do we do after you realize that you or someone has the symptoms, going to the hospitals, and how do you differ it from being like it's a witch or a wizard that have caused something?
Okay. So too many questions. Okay. So when someone feels he has a mental health illness, you have to seek help. That if you identify it yourself, you have to seek help. It's not just going to go spontaneously. It won't go by itself like that. You would have to engage professionals for help. You have to engage psychiatrists, psychologists. You have to engage your therapist and things like that. There are professionals who have been trained to be able to help you out of this. And for mental illness, it's important for people to realize that it's not a one-time treatment. It's not like malaria, you take your medications for 3 days and you're fine. It's usually long-term because you have to undergo a number of sessions of therapy. You may be put on medication. You may have certain activities, yes, with your therapist and all. So it takes a long time for treatment. Mental health, people with mental health illnesses may not recognize that they are ill. So that's a huge responsibility on their caregivers, their relatives and friends to be able to identify symptoms on time. With spirituality and mental health, there are a number of research on it. People have brought some research that suggests that people who tend to be spiritual tend to have some sort of immunity against mental health. That is, they tend to have psychological and spiritual comfort in their religion or in their spirituality, that they are able to push through the difficulties of life. They are more hopeful that things will get better. They are hopeful that there is a spiritual being or a supreme being whose hand is in their life and can turn things around. So most of the time, those people, research has shown that they are less likely to have mental health illnesses.
Okay.
Some people have also shown that when they have mental health illnesses, they use religion as a coping mechanism because they are hopeful that things could turn around. And it's even recommended that when we are managing mental health illnesses, aside the biological component, aside the psychology, the therapy, the medications, people who actually believe in a supreme being or ascribe to a particular religion, we encourage them to still combine their faith-based practices with the orthodox management, and it tends to bring about higher outcomes. For example, if you are taking your medications, you can still pray about it. Your reverend father or your pastor can still visit you. Your imam can still pray for you. If you combine the two, many people have proven that it's a coping mechanism and it brings about better outcomes. You cannot separate religion from mental health. In fact, from the onset of mental health, it had so many religious underpinnings. So you hear the term lunatic. Luna has to do with the moon, because
Okay.
people thought that it was the appearance of the moon that made them behave the way they behave. When the
okay.
moon is full, then they said they are lunatics. They behave that way according to the appearance of the moon. So because mental health has to do with our social well-being, and you can't take away religion or spirituality from our social life, so it plays a huge role. And because of the abstract and faith nature of religion, most of there are things we don't see. There are things we believe by faith.
Yeah.
And in mental health today, there are things you don't see. If someone is having a mental health issue, it's not like you can check the blood and you just be able to pick it up. There are things that are quite abstract sometimes. So people tend to ascribe certain mental health illnesses to spiritual causes.
Okay.
But we, from the medical perspective, feel that there's also a biological basis to some of these things, or there are some biological components which we can deal with at the health aspect. If you want to combine that with that's fine, that's okay. But then it doesn't rule out the fact that when there's a mental health illness, the person should seek professional help. So there's a link between mental health and spirituality. But
Okay,
then-
so I want to take your final words and then tell us what your organization does. Awareness Foundation, what do you do? I think you've done some of these, a lot of advocacies on mental health in schools. So just tell us in general.
Thank
what
you very much. So Awareness Now Foundation is a mental health advocacy group which was established somewhere last year. Basically, we are into mental health advocacy, where we reach out to as many people as possible, explaining to them what mental health illness is, encouraging them not to stigmatize, teaching them ways by which they can safeguard them, keep themselves, should I say, healthy mentally, and also ways they can seek help in the event that they or someone they know is suffering from a mental health illness. We are also involved in partnerships with other organizations which have similar ideas like us, similar goals like us. As part of our advocacy work, we basically concentrate on the youth because of the advent of substance use disorders, particularly in this northern part of the country. So we visit secondary schools, we do media outreaches where we do advocacy on mental health as well. We also have a branch where we reach out to individuals with mental health illnesses, and we try to support them with their care by either providing medications for them, linking them to the appropriate health workers in hospitals, the psychologists and the psychiatrists, where they can get the needed attention. We also have sessions with their family, more like family sessions, trying to teach the carers how they can take care of their relatives, because mental health is not an illness that affects one person. It affects the carers. If you have someone who is mentally unwell, that's a huge burden on those
the
who have
family,
to take care of them, feed them, make sure they take their bath. You have to watch over them, else you don't know what they'll be doing and things like that. So it's a huge burden on the carers. And the outcomes of people with mental health illnesses is highly dependent on their carers. If their carers are they involve themselves in the management, they are forthcoming, they are available, they offer social support, emotional support, most of the time the outcomes are better. But for people who just say, oh, he's smart, let's leave him, and they just allow the person, then it becomes difficult to help the person. And usually when it starts at the beginning, it's always
Manage it
easier
and,
to
treat
manage
it.
than if it stays for a long term. So the relatives or the family and friends have a huge role to play in the management of such persons. So we have sessions with those people also. So it's a growing organization, and we also encourage people out there to reach out. If you know someone who has a mental health illness, you don't know what to do, you need someone to talk to, you can always reach out to Awareness Now Foundation.
Okay. Thank you so much for coming. It's been a great session. Today I've learned so much on the different kinds of mental illness and how they are, let me say, almost similar. Some of them are kind of similar, and how we can all take care of ourselves. I was speaking with Dr. Norbert Kipo, helping us to understand mental illness. He's also one of the members of the Awareness Now Foundation as well. So like he said, you can reach out to them. You can also reach out to us so we can get you in contact with them if you are an organization or a school that is looking for them to reach out to you with some of these education on mental health, especially for your students. And students, most times goes through a lot of these issues because they are studying, there are lots of things happening in school, and they have to balance all that at that young age to still stay strong and healthy. We need to keep our youth alive and help them stay strong. I am Martha Spice. Thanks for watching. Have a good night.